just tell me in the chat, what is it that you learned that you personally found most value in, and what potentially would you like to have learned more about, or what do you think that I could have done to give you even more value? So tell me what was great and tell me what I could do to give you even more value. I would love to know. So if everybody would just do that for the price of admission, basically, I would love to get your feedback. Your feedback's really important to me. So if you can go to the chat now and do that, that would be awesome. I'm going to give you a moment to do that. Okay, and now while we're finishing doing that and we see the responses coming in, then what I would like to share with you is something that we have very limited spots left, and that is we have just a few spots left for those who qualify to apply for a semi-private session with me. We call that session, It's All About You. In this session, I talk a lot with you, but in that session, you get to talk a lot with me. I get to learn all about you and get to know you better, get to know your body better, what you want to achieve, what you're up against. And I would love to do that with you. There is just a short application process to do that. The session's free, and it's specifically for those individuals that are interested in seeing what comes after the full body fix also. If you're interested in what comes after the full body fix and you think that fits you, then please go ahead and go in the chat as well. And there's a link there for you to be able to register yourself in and apply to register yourself in for a It's All About You session. And Patricia will drop the link now in the chat for this. And then while participants are looking at that link and applying to schedule for a semi-private connection with me, we will give you a moment to do that. And then we'll go into Q&A. Looking at all the great responses coming in here.
You're muted, Rob.
And I'm just finishing reading the responses, and then we'll get started with Q&A. Awesome. Thank you for sharing those things with me. And Julie Shearer in Edinburgh, Scotland. That's awesome. Patricia and I are actually going there in August. So very exciting. And let's get started with Q&A. So Q&A, how does that work? How do you participate? So very simply, you might know this by now, but you go to the bottom of your Zoom toolbar and you'll click on reactions. And then when you click on reactions, a box will open. And then from that box, you'll click the bottom button that says raise hand. So bottom of your Zoom toolbar, reactions, click, box opens, click raise hand, your digital hand will raise, and then the order of which you raise your hand I will call on you for questions and answers and having a great connection here. Looking forward to doing this with you. And Rosanna, we're going to give you a little link if it's possible to start your video so we can screen share together.
I sort of don't see my video. Sorry, I don't know how to start my video. I click the link, but I can't.
It's okay. It works.
Okay. My question is, I already wrote it here. I'm also here in UK. I feel one leg longer than the other one, although they have measured them and they always say it's the same. But I have pain when I walk on one side, on the right side of my hip. And I wonder, can be this misalignment?
Yeah, so this is due to a lateral pelvic shift. So we talked a lot about this plane of motion with the posterior pelvic tilt
Yeah.
and the anterior. Well, what you have is more related to a lateral shift where one side of the pelvis hikes up. So this is looking at the mobility of your tissues on each side of the spine.
Yes.
So we have some tests for this, of course. We have a lot of tests. I use some of them in full body fix, not of course all. So one of the things that's really helpful with this is if you kneel on a very soft surface, which is going to put your hip flexors in the long position, and then you reach straight up and you try to keep everything from here to your fingers aligned, and then go to one side, go back to the other, go to the other side, and see if you have a difference in the mobility to going to the right versus going to the left. And very likely what you're going to find is that the side of the leg that's shorter, that you think is shorter, that side pelvis is higher. And when you go away from that side, you're going to feel greater tightness. So this is the likelihood of what's going to happen within. That's because your lateral pelvic shift, which is then shortening one side of the lower back, lifting the hip joint basically because the pelvis is adjusting there. So that's a test that I would suggest you do. And there's other ways for us to test that also, like in our VIP training system, we look at all this lateral motion, we look at all the motions, and we could test you to the actual degree. Not sure if that makes sense for you to apply for being a VIP or not, or some coming and see me as semi-private session if you're interested in being a VIP, but that's something we could help you with further.
Okay.
There's some details that need to be looked in to really figure out what is causing that.
Okay, thank you very much. It's
You're
lovely to be here. Thank you.
Lovely to have you here. Lots of love to you.
Thank you. Bye.
Bye for now. And Robert, hello, welcome, sir. One second, we're working on getting you unmuted here.
There, I think I got it.
Yes.
Okay.
Hello, good morning.
Good morning. I have a similar question, but it's because I had a hip replacement about 4 years ago, and I've never walked normally since. And the pain I feel, a moderate pain, is exactly where the surgeon cut the muscles in order to insert what he inserted. I've heard that it often occurs that when you have a hip replacement, your foot is shorter than your other foot. So it's similar to the woman's question that she felt that way too, but not because of an operation. But it really affects my ability to walk normally. I'm going around kind of limping. My other foot is 100% a-okay. But I need a cane to walk any distance, and I want to know if it's fixable.
So you mentioned the foot a couple times, but do you just really mean the length of the leg seems to be shorter on the hip replacement side? Is that what you're really saying, or do you have an issue with your foot?
That's what I've heard. I haven't actually measured it. I don't know if it is shorter or not, but if it were shorter, which is a common result of such an operation, would that throw me out like that and cause me to limp? Because that's what's happening. I have a limp. which
Yes,
by the
it
way,
is.
yes, yeah.
Yes,
What-
it is. It is very possible for that to happen. You know, the surgeon should, one of the things they should really be very meticulous about is exactly that, is looking at your greater trochanter, which is the hip, the bone outside of your femur, the top of your femur, and measuring this down to your heel and getting the accuracy from one side to the other. That's a really important job of the surgeon to do that. I would assume that they would do that, and that therefore it's not so much a leg length discrepancy or difference. It's more of the, again, the pelvic alignment being a little off, where the one side of the pelvis, and one way for you to be able to tell this also is just stand in front of a mirror and feel around for your pelvis, and you'll feel the bone. So you'll feel the bone coming up, and try to find the same exact top ridge position. I mean, spend like a couple minutes, you know, really be meticulous about where you're feeling in the pelvis. Get your thumbs on the same side, same point on each side, and you can do this in front of a mirror, and you're going to be able to see, is one thumb higher than the other. So that's
If it
one.
if it is there a fix?
Yeah, yes. So one of the things that happens is leveraging back, or going back, tying back to the hip and knee set, or knee and hip session. When the glute medius gets weak, one of the things that happens is you'll shift out to that side, and especially if you feel like it's the side that had the surgery that's shorter, it's very common for those hip muscles to shut down because they've been traumatized, basically. And when you traumatize this tissue, it guards, it decreases mobility, it decreases strength output. And so, you know, surgery is trauma, and obviously the injury that was there prior and the pain that preceded with prior surgery is all trauma. So then the tissue functionality shuts down. And one of the major tissues is the glute medius, which attaches to the top of the greater trochanter there, and then into the pelvis. And when that tissue goes weak, you shift out to that side, allowing that side pelvis to raise up, and then the other side drops down. So in simple terms, the way the glute medius works is this: the right glute medius holds up the left side pelvis, and the left side glute medius holds up the right pelvis. Because of where it's at, when it shortens, it lifts the pelvis up. So if you have a weakness on one side glute medius, the pelvis is going to shift in that direction. So what do you do about it? Well, first of all, you want to use the testing that we did in the knee and hip session, and you want to see where you may have variations in mobility, right? So anywhere where you have a significant variation, which would be 10% or greater, those are areas you want to really address. Then you're going to want to develop optimized symmetry, strength symmetry. In other words, even strength on both sides of your body. And one of the best ways to do that is single leg standing exercise, which is one of the reasons why, like in today's session, we do the single leg exercise, and I have Keith bend his knee, and then we rotate. It's really to get like a dynamic stability, the hips moving, and you're needing to maintain alignment of the pelvis. There's many exercises that build from that starting point, but having single leg strength is very important. Another thing you can do, very simple, is walking upstairs. You would hold the top of your pelvis and apply everything I'm teaching you thus far: the foot alignment straight, hip, knee, foot straight, pelvis neutral, pelvis level from one side to the other, and then make sure alignment number one, otherwise it defeats the whole purpose of what I'm teaching you. Then you step up, and you start training your tissues to maintain alignment one leg at a time. And that will start really helping to strength train the gluteus medius. And then just tying back to everything I shared in the knee and hip, and making sure you have equal strength. So remember when we lay on the side and we lift the leg up in session 2 on Monday. So this exercise, you also want to see, do you have even strength? And if you have discrepancy in strength on doing that exercise, then you do more reps and more often, more focus on the one side that's weaker. And most likely what you're going to find is the side that's weaker is it'll be the side that's showing short, which the pelvis is shifting towards that side. So that kind of gives you the etiology and breaks this down for you.
You mentioned something yesterday, our last session, and it really helped. A very simple description of how to walk. And when you walk, your toes and your rest of your leg are straight. And I kind of walk with my foot off to the right. So I consciously walked with my foot straight, and it made a palpable difference right away. And I thought, wow, this is significant, that I can walk much better now just because I realigned.
One more thing that's really interesting to tie in with what you're saying is the side that you feel like could be shorter.
Yeah.
Is the side that the foot turns out more.
Yeah.
So a couple things with that. One is turning the foot out will make that leg present shorter. The other thing is it's also telling us that side hip and everything I just said about the gluteus medius is true for you. And the way I know that is because your foot's going to go in the direction where you feel like you need to have more stability. So if your pelvis is shifting out here, your foot, without thinking, unconsciously, your foot's going to want to turn out, because that's going to give you better stability in the direction that you're leaning. So you have many signs that are telling me that you actually do have a lateral pelvic shift. And then what I shared can start helping you to put you back together again with all of this.
Thank you.
Yeah.
Thank you very much.
Yes, sir. Absolutely. Being a VIP, we can tie all of that stuff together, optimize you, align you, strengthen everything from your foot to your hip, and get even more specific. So I would invite you that if it makes sense for you to go ahead and go in the chat and apply to come see me for a semi-private session. That option is there in the chat for you. And lots of love to you, Robert. Make it a wonderful day, sir. Thank you for your questions. And Teresa, hello and welcome.
Hello, I'm calling from the UK as well.
Awesome.
Hi, unfortunately, I've been under
Afternoon, right? Good.
yeah,
Good
afternoon,
afternoon.
yeah. I've been under a lot of stress, and my husband had a brain hemorrhage stroke, and my spondylosis has got worse. And last year and this year, I keep ending up in a wheelchair. So I'm just wondering, when I'm in that really acute pain, and I'm struggling to move, should I try and do some exercise? Also, I do have a habit of sitting with my legs up. Is that a bad habit? And when I've seen osteopaths in the past, they've never been able to get my legs straight, or if they can, they go out again quickly, and I react really badly to osteopath treatment. My back sort of swells and gets worse, and I guess perhaps it's not holding because I'm not doing the appropriate exercises for my back to be strong enough to hold it, or is it just the joint hypermobility that's causing that?
So you shared a lot of things there. I'm not sure if you're hypermobile or not. Maybe you are, and maybe you, if you're very keen on that and you're very aware, then okay, let's go with hypermobile. But I'm not sure.
It was diagnosed by an osteopathic doctor.
Okay, awesome. Well, not awesome, but we have clarity. Awesome. So hypermobility, you're going to want to focus excessively on stability. So you're going to want to have a lot of focus on stability. If you already have a lot of mobility, doing stretching and stuff's not going to really help you. Could actually worsen this condition. So it's going to be a lot based on stability. And then, as you learned in today's session, it has everything to do with that pelvic alignment. So then you ask me the question of, is it bad to sit with the legs up? Well, if you're sitting with your legs up, you're more likely to have your pelvis in a posterior pelvic tilt. And if you are an individual that usually has a posterior pelvic tilt, so when we did the anterior posterior pelvic tilt test, did you figure out which direction you're more fixed in? Was it anterior with a bigger back arch, or more of like a butt under flat lower back? Did you do that one with us?
Probably it was the first one, I think, because I'm having problems standing at the moment. I did stand for a little while, but I couldn't stand for long.
Okay.
So probably the first.
Okay, I'm guessing it might be the posterior, but I don't know because I didn't see you do this. If you're able to stand, I could tell you if you want to do that here. If you're not comfortable with that, that's okay too.
I have got a support on my back, a tight sort of support around
Sure,
you as
sure.
well.
Okay.
So,
And
I don't know.
yeah, no, you have a posterior pelvic tilt. Yeah. Okay. Thank you. That's helpful. Yeah, you have a posterior pelvic tilt. So you have more of a flat lower back, and I can see the angle of the pelvis is more towards posterior. So you have a situation where because you're in this butt tucked under position, the pressure of the disc is more in the front side and it's pushing the disc back. So that's what led to the spinal degeneration that you have. So for you sitting with your legs up, it's going to put you in that posterior pelvic tilted position. You're an individual that needs more lumbar support and lumbar support. And when you use lumbar support, it's probably going to make your back feel better and take pressure off those nerves. You don't need a lot of lumbar support, but enough to create some lower back curvature. So I would encourage you and feel for the position. Like, I think what you're going to feel is when you have lumbar support, you're going to feel more stable, more aligned, and less pain when seated. And the big thing is strength training, your transverse abdominals, which is the abdominal muscles that draw inward. So like if you were to do abdominal exercises that focus on drawing inward, and you can just do this with holds too throughout the day. You don't necessarily have to be in, exercise mode per se, but just seated, you draw from your pubic bone to your lower rib cage in as strong as you can, and then hold for 10 seconds and let it go and relax and get up to like 20, 30 seconds holding at a time. That's going to greatly help increase the strength of all the tissues around your lumbar spine and get it in better alignment. So when we draw the abdomen in, it's like it's your internal weight belt, and the transverse abdominals is like a belt that you're wearing basically, but it's a little longer and it's through your whole midsection, and it ties in your rectus abdominals and your obliques and your what's called your thoracolumbar fascia, which is like connective tissue in your back. It ties all these things together, and that's the connection point for all these tissues. So when it's weak, then all those tissues they don't have a stable brace in which to all work from. But when we have a good ability to draw in, then we have a good ability to attach to that anchor point all of the other tissues. So that's the reason why that's so effective. So that's what I would encourage you to do for now. Like your lowest hanging fruit for the most results: lumbar support, transverse ab strengthening, many other things that you would need to do. But those are your lowest hanging fruit where you're going to get some significant results and immediate improvement.
So not to sit with my legs up at all.
I would test it. I would test it. Like, okay, let me sit with a little bit of lower back arch. You can even order something like online with lumbar support and see how you feel with that versus having the pelvis more. Because, when we lengthen the legs, when the legs are going up like this, it's going to pull the pelvis down and under into that more posterior pelvic tilt. And I'm guessing it's this position, based on looking at you and seeing the issues that you shared with me, that your spinal degeneration came from that posterior pelvic tilt pattern being excessive. So when we go the other way and we have some lumbar support, it's going to help decrease the pressure from that area.
And the earlier stand loss, hypermobility as well, would that have caused it?
Yeah, definitely. Yeah, you have. You have, because you have joint laxity and hypermobility, then you don't have as much stability. And the biggest thing for the pelvis and the low back is stability. There are some factors of mobility that are important, but the biggest, like it's 80% for pelvis and low back, is like 80% about stability and 20%, maybe 85 and 15% about mobility. So, and the mobility factors is like that it's even. It's not even that it's a lot. You don't need to have a lot of mobility in your lower back. You need to have very even symmetry from one side to the other, and really the hip tissues being very mobile. That's super important for your back. But the back needs to be aligned due to the pelvis and due to the thoracic spine. Those are really the key factors. Yeah.
And strength training rather than stretching.
Yeah, for you is strength training rather than stretching. Yeah. And strength training does have a stretching component. I think everybody will find this interesting. So when you strength train, especially if you do it sub-maximally, you know, you're doing it in something that feels comfortable, but yet still produces a strength result. So for example, let me give you a simple example. When you're doing a bicep curl and you lengthen your arm, the tissue is elongating. So you're actually training the mobility characteristics of the tissue when you do what we call the eccentric phase of an exercise, which is when the tissue's contracting and lengthening. So like in the lower back, contracting and length is when you bend over and you round your back. That is the eccentric action, which, by the way, you'd want to be careful of that motion, having the condition that you have. But it'd be safer for you to do something like that on the floor where the back is being supported by the floor. And then you could round your back and do like what I taught in today's set: posterior tilts, anterior tilts, posterior tilts. This will be a really good one for you as well. Yeah,
Okay,
and then
brilliant. Thanks.
ideally, Teresa, you would take these things and then build a foundation and then build into more complexity in your training and thoracic rotation. And there's many facets which get built onto this foundation that I've just laid out for you. And again, our VIP training system, we put all of that stuff together for our VIPs, but yeah. But that gave you a good place to start.
Okay, thanks so much, Robbie.
You're very welcome. Lots of love to you. And also for you, the link is in the chat if you'd like to apply to schedule for that It's All About You session. And Paula, hello and welcome to you.
Hi, thank
Hi.
you. Today was wonderful putting it all together. I have a question on lunges. When I am lunging, at least trying to align everything, a knee bothers me, right? Going up and down. I compensated a little bit today by not going down as far. What recommendations would you have?
So I know you asked me about lunges. Did you mention you're talking about the stairs too? Was this, or no, you're just talking about the descension, ascension of a lunge?
Descension and ascension, yeah, lunges in general.
So can I see you do the position? Is that okay? Yeah, your camera's about yeah, if we just move the chair out of the way a bit and go by the door. And if you can bring your camera down, I don't know if it's
Yeah,
possible.
I'll put it on the ground, it's probably better.
Oh, no, I think it's perfect. Oh, that's where, actually, yes, I agree.
Yeah.
Yeah, yes.
Okay.
And then you're going to want to face the camera.
Okay.
Yeah. So what we see from the side is important, but really what we see, yeah. So let's do this. Maybe go towards the wall a little bit more, just a little bit more. Yeah. No, sideways. You're going to move sideways towards the wall. Yeah. So Paula, can you see?
Everything is, I have to
Can you-
think about that.
Paula, can you see me? Can you see me in the camera?
Yes, if I turn my head. But
Okay. Okay, so what I want you to relax. Hold on, relax. So what I want you to do is face back towards the camera, because now we have the wrong angle again. And what I want you to do is go to your right like this.
Oh, just walk to my right.
Well, that's your left. Yeah, you're right. Yes, to your right. So a couple more inches to your right. Yes, there we go. Okay. All right, so now go ahead and show me a comfortable, stay in your comfort zone. Don't do anything that really stresses your body. Stay in your comfort zone and show me. Okay, all right. And then come back up. Okay. And where do you feel knee issues?
So when this now it's this knee, before it was me.
Okay.
Yeah,
And then,
as coming up, I'm feeling a pinch
and
here.
is it always the back knee?
No, when we did it earlier, it was the front knee.
Okay.
So. Yeah, and it
Yeah,
almost feels like it's a weakness and I'm going to, kind of bundle over.
And let's see the other side. And turn, do a little bit of a rotation back towards your camera. Yeah, so yeah, do a rotate because you're facing not towards the camera and basically the angles are going to, yeah, there, yeah, perfect. Okay, so get into your comfortable lunge position and do this side to your comfort. Okay, good. Okay, stop. All right. So, how'd that back knee feel on that one?
The back knee, when I'm back, now it's this side. Mhm.
Yeah. So in this side, with your left knee forward, you have your knees going in. So you have a few things going on, and this is going to actually be really easy to correct because there's a reason why you're feeling pain. So your knee is going in. So your knee is actually caving in. It's going into what we call a valgus position. So remember, it's really important your pelvis stays square, and then your hip to your knee to your foot is in one straight line. Yeah, it's very important. So like when your left leg, you did good on your right. Now, and now the camera angle is not going to be helpful for us to see what's happening. But on your left leg, when you did it, your left knee is going in. Okay, so that will absolutely cause shear stress in your knee, which will cause either over time degeneration or even immediate onset of pain. And it'll decrease strength, and it does a lot of negative things. So pelvis aligned perfectly, first of all, feet straight. Then we got to make sure the hip, the knee, and the foot are in one straight line. And it's really important. What most people pick up early on is the foot to the knee. And what they miss is understanding that the hip to the knee needs to be straight also. So like what I see, even experts, when they're learning this stuff, they don't catch this, that the pelvis to the knee, this needs to be straight already. So like the pelvis already needs to be here, and then hip to knee needs to be straight. When it's not, your knees, like you're basically taking your joint and going like this to it, and that causes shear stress, breakdown, pain. The other big issue that you have with your lunge is you have a really narrow, and I'm wearing all black here, so sorry, it's a little difficult to see, but your back knee is really far forward. So you're basically putting your knee in this position where you're going to have excessive stress because it's pointing forward. It's not going straight down. So when you do a lunge, your back leg should be either pointing straight down or slightly backwards at like up to like a 10-degree angle going backwards. So like if I'm doing a lunge, my right side here will be either straight down or slightly at an angle like backwards like this, depending on your mobility. Okay, so changing those things, and you can probably feel as you start to get out of that position and bring that back foot further back. Yeah, it's a much less knee pressure, and you're removing the shear stress as well. So that's what I would have you do. Also, I think it's best for you to learn a lunge with band assistance. So band's very similar to what you have there laying over the chair, but you're going to need to use the really strong version of that. And what I would suggest you do is you get a door anchor. Patricia can drop the link in the chat for this, but you take your band and you put a door anchor, which the bands come with. You have that?
That's right here.
Exactly.
Yeah.
Yeah, perfect. It's not the right bands to do what I'm talking about. I mean, you can make it work because you clip them. Just be careful of like where you're going to position on your body, because it could get uncomfortable with the hooks digging into your back. So I would suggest a continuous loop band that Patricia will post. But doink over the top of the door, bands go underneath the armpit, and you can kind of support yourself with that, and then do the lunge in front of the door, and it's going to decrease body weight so that you can focus more on mechanics. And it's what we call the regression, and you get your lunge really good from that stationary position, focusing mostly on alignment and caring least about how much range of motion. Range of motion will come, but we got to kind of earn that with alignment first. And then over time, you'll get strong enough that you don't need the bands. You can do the lunge on your own. You have good alignment. The tissues have been strengthened, and it won't create negative results for you.
Okay, great. One other question on going through our assessments, and then we decide here's something we really need to work on. As far as how often per week, is there a rest day in between doing the exercises, or what's recommendation?
Anything that's muscularly fatiguing, you should wait at least 72 hours before you train those tissues again. So if you create a muscularly fatiguing effect, you should wait at least 72 hours. And with stretches, if they're very gentle and it's like you don't really you had zero soreness afterward and there's no muscular fatigue, you could do those. I wouldn't do it every single day without break, but you could do as close to that, like more than you could do every other day to even more than every other day. In other words, if you did 3 or 4 days in a row, at least take a day break and then go back to your everyday. So, and that's for gentle stretching exercises. So anywhere from every day to at least a 72 to 96 hour break, depending on how fatiguing the exercise was.
And then my last really quick, I think I know the answer, but I want to ask it. Sitting in the chair, I'm assuming everything we did to realign our body when we were standing, that's how we want to be sitting in our chair as well?
Yes, exactly.
Okay.
Yeah.
All right.
Exactly.
Thank you so much.
You're so welcome. And Paula, in all of our full body fixtures, another thing that's really good is when you're seated in the chair, it's very good to do that thoracic alignment breathing. We're letting the abdomen come out. We're breathing in from the rear rib cage. Then we're realigning the pelvis. This is a very good thing to do from seated position. Easy to do, and it will strength train all of your tissues. It'll strength train all of your core musculature, your pelvic floor tissues. It'll really help you in many different ways. So I would encourage you to do that from seated as well. And hello, Dahlia. Hello and welcome to you.
Hi.
Hi.
I've had, first of all, this is fantastic. I've had a back pain over here for about a year. I've done physiotherapy, exercises, and it's very slow in healing. Now, doing all these classes, these 3 classes, I've noticed how unaligned I am. So no matter how much physiotherapy I've been doing and how much exercise, it doesn't go away because I keep going back into bad posture and bad alignment. I know I don't have good posture, and I know that for years, but it's like exercises. So this gets to the source of the problem. So it's like, it's so much, if it's on my body, I see it's unlined. I have a flat foot, my knees go in, I have a lateral goes like this, I have a thoracic, everything you said I have. So what do I concentrate or just do everything? And what's the program I can do for myself when I know I have a lot of issues that I've been doing exercise all my life, 20 minutes in this past year, I've had to almost stop anything. The only thing I could sort of tolerate was Qigong. So it's like standing and, not anything, or I used to always do strength and, name it, but I couldn't because it would cause me pain in my back. And I was just afraid of doing anything. So how do I go on from now? Now I know all these things I have to correct.
So 2 ways. I'm going to give you some do-it-yourself solutions, but if you were to become a VIP, we put all of those things together and you have my elite experts analyzing your body and figuring these things out and tying it all together to be appropriate for you. So that would be the number 1 most effective way by far. But the second advice that I can give you in terms of how to approach this is you take the areas that are most outside of ideal alignment and also have the greatest symptoms attached to it. So like if you have a lot of lower back issues and if that's the greatest symptomatic issue, and you seem to find that that's where you have your greatest misalignment issue, then you'd want to focus a lot on that area. So you'd focus on the areas that you have the greatest misalignment first, and then you kind of go down the down the chain. You should address all of it. You should train your whole body. You should do all of it and kind of set up a schedule and sessions throughout the week. But it's very important that we focus on the biggest misalignments first, because those are the areas that the further you are outside of the ideal, the more we get into the red zone, and then the more it's like guaranteed to cause an issue. So
you do it every day for how long? 10 minutes, 5 minutes, 20 minutes? Or what do you suggest?
so
How do we?
in the strength training exercise, this is an exercise that you can feel a strength requirement to perform. These are good to start with like 2 sets of 15 if you're not really adapted to exercise. 1 to 2 sets of 15 repetitions is a really good place to start. And you'd want to rest on your strength days 72 to 96 hours. And then with your mobility exercises, you'd want to, you can do about every other day would be appropriate for you.
Mobility every other day. Okay.
Yeah. And remember, the only mobility exercise you really need to do are the ones where you're certain you have a mobility deficiency. Yeah, and you can focus more on one side more than the other. But yeah, you want to focus where you have a mobility deficiencies for your stretches, and then strength exercise 1 to 2 sets of 15 every 3 to 4 days.
Okay, so you've given me some hope. The physiotherapist did not give me. They just should do the set. It should be gone in a week, and that was in October and August. So it's just it's an amazing work that you're doing, and I really appreciate it. It's a whole flip around of how to approach exercise. You're doing fantastic work. Keep up the good work and help people. Really, you're doing fantastic. Since I worked with seniors for 26 years, and I taught movement to them. I know how important is proper alignment, but for myself, you don't, the shoemaker goes barefoot, you know what I mean? So,
Yes.
so thank you so much.
You're so welcome. And yeah, it sounds like you'd be a perfect fit VIP. So I highly encourage you to look at that.
Thank you so much.
Yes, you're welcome. Patricia, any announcements from you or any other questions you'd like me to answer?
No, so my announcement is that we have this session repeating again is 10 minutes, starting in 10 minutes. So if you would like to rewatch or you arrived here during the Q&A, we will restart the session in 10 minutes. And also we have another play of the session at 2 p.m. Pacific time. So you're welcome to join us at this session as well if the time works better. And for all of you that scheduled That's All About You session, we're looking forward to seeing you today or tomorrow. And if you're not scheduled, you're just scheduled for the next session. I'm looking forward to seeing you on Friday for session 4 of the full body fix, which is, Robbie?
Shoulders and neck.
There you go.
Yes.
Bye,
So,
full body fix.
Looking forward to seeing you on Friday, or stick around as Patricia shared. And whatever you do not miss Saturday's session. That's my favorite. We'll see you then. Lots of love to you. And this meeting will stay open and will resume in under 10 minutes.